Hello, everyone. My name is Leah. Um, um, uh, I'm majoring in public health and minoring in public administration. My program focus is on global health. Before I begin, I'd like to acknowledge that I'm speaking from the traditional and unceded territory of Husainach people. I'm grateful to live and learn and work on this land. Over the past 3 months, I completed my practicum with the Education and Practice Support Team, or the EPS team within Island Health Population and Public Health Department. In this presentation, I will introduce the team I work with, share my learning goals, highlight the key project I was involved in, and reflects on the skills and public health social policy values I applied throughout my experience. I also will talk about how I connected theory to practice in a real world public health setting and share some key insights I gained from working with such an amazing team. So the education practice support team is an interdisciplinary group within the population and public health at Island Health. We work remotely across Vancouver Island to provide equity-informed education and practice support. The team is led by Tracy Beaton and includes four public health nurse clinicians, one allied health educator, a resource coordinator, and a policy development lead. Our work includes staff orientation, professional development, practice support, knowledge sharing, and technology guidance. These supports all aim at promoting consistency, collaboration, and continuous improvement across the population public health portfolio within the organization. So this slide offers a snapshot of my role, responsibilities, and how I applied the core public health social policy competency during my practicum. On the left, you can see the key competency I aim to develop and apply, such as project planning and evaluation, interprofessional communication, capacity building, and analytical thinking. To build these skills, I contribute to projects like CD Education Session Toolkit, the Team Intake Tracker, and Document Inventory Tracker, and TCB Procedure Guidelines. I also supported the design of our team internal evaluation process and participate in team learning activities like Launch and Learn and Learning Bursts. Through these experiences, I strengthened my ability to apply theory in practice, support collaboration and decision making, helped improve workflow within our team. This experience also deepened my understanding of cultural safety through our team monthly cultural safety discussion sessions. So I will now talk about two projects from my practicum. One is from the beginning and one from near the end. The first project I worked on was a city education session toolkit. This is a resource support presenter in planning and delivering city community of practice education sections. This aligns with our team focus on professional development and aim to make sessions more efficient, consistent, and audience-focused. There are three elements in this toolkit. The first tool is the needs assessment survey. It's a short survey intended to be sent out before the session planning. The goal is to help a presenter get a sense of what the topics the audience is most interested and how they prefer to learn. The second one is the presentation template is designed to support a presentation prepare of the session. The goal here is to save presenters time and offer a structured starting point. The third element is the feedback survey. This means to share after the session to gather feedback from the participants. It helps us identify what went well and what could be improved. I receive a lot of hands-on support from my team throughout this project. They provide a lot of thoughtful feedback and suggestions during the development of this resource. I also was able to present this project during the city community meeting. Um, and then I was able to launching and publishing the toolkit within the website of the PPH community. So towards the end of my practicum, I worked independently on the EPS request tracker, a tool designed to help the team monitor, organize, and follow up on incoming requests. I follow our team's SMART goal work process under the development milestone. I completed three deliverables. One is a literature review, environmental scan, and the first draft of the tracker. Well, I didn't find any existing tracker in the literature. I did come across a helpful. I did come across a helpful method called the bulletproof problem-solving framework, which I use to guide the design. I started by defining the problem, then broke down what we need to track, and then prioritize the most important function to include. I also reach out to other teams as part of my environmental scan. One key takeaway was that declined and referred requests usually are not tracked within other teams. So my first draft, the tracker offers the number and the types of requests that we receive and who they are coming from and which teams, how long each request takes to close, which one are declined or referred, and then why. Also, common themes or issues that keep coming up. These data can actually support our work planning, process improvement, and help justifying staffing or system changes within evidence. So during my practicum, I applied the three key public health social policy values that guide my learning and contribution. The first one is the interdisciplinary collaboration. I work with public health nurses, educators, and policy lead by using the collaborative framework, which emphasizes mutual respect and shared decision making. This framework also shaped how I work within our team and with other teams in the public population health within Allen Health. I also prioritize the cultural safety and inclusion by participating in monthly discussions on the indigenous health equity. These sessions influence how I approach each project and reinforce my commitment to culturally safe and responsive practice. Finally, I supported co-creating the tools like intake tracker and city education toolkit by helping standardize the clinical guidelines. These efforts address the frontline needs and reflected my commitment to capacity building within the community under the understanding of social determinants of health. So for the call to action, I ensured the number 19. This call underscored the importance of closing health gaps between indigenous and non-indigenous populations through culturally safe and equity-informed practice. During my practicum, I participate in monthly cultural safety discussions within our team, which become a space that we challenge assumptions and explore indigenous health equity in a meaningful way. Working through this commitment helped me to see reconciliation not just a saying, but also be participating in a meaningful way in the both public health system and also my personal practice. Uh, I, as I reflect this journey, I'm grateful for how much I've grown both professionally and personally. I was deeply inspired by people that I was working with in the population public health. Their dedication reinsured my own commitment to public health. Through this practicum, I also came to understand why some projects takes time, because meaningful work it needs requires a collaboration input from those got affected, and then we need the resources to support standardized practice. One moment that stood out to me was the seeing perinatal teams' dedication to standardize the TCB guidelines, which supporting the babies and family within the community will ensure the best practice are followed within the community. Most importantly, I was able to apply what I've learned in the class to a real world public health work, contribute to projects that's meaningful within the community and the team. Before I wrap up, I want to thank the EPS team for their support during the past 3 months. And I also grateful, special thanks to my course instructor, Margaret, and Heather, who set up for our practicum resources, and then all my past instructors in the past few years. That their mentor really makes this experience different. I'm leaving this practicum and this program feeling inspired and ready to keep learning, growing, and giving back in the communities. Thank you.